Surat. Today gathered here to hear a little bit about preconception counseling. As the word is self-explanatory, it is the counseling which is done before the actual conception starts. So it is before you actually conceive a child. We live in an era where men and women are both working, and we're both working quite a lot to make ends meet, sometimes just because we are good in terms of our career, we're good in terms of our intellect. We need to keep working. Such happens that we do not want unplanned pregnancies. So it is an era of planned pregnancies. Obviously, when you're planning something, you want it to be a perfect planning and not a haphazard planning. And therefore, the picture of preconception counseling comes into play. It is a method of optimizing the maternal and child health, both in the long and the short term. In the short term, obviously, because it helps immense benefits to the mother while she is pregnant, while she is delivering. In the long term, in terms of consequences it has on both the child and the mother's health, once the delivery part is over. Preconceptional counseling has multiple facets. It is not just about the mother that we talk about, it should also be the father in question that has to come into picture. Both the parameters have to be evaluated well so as to reach an optimum output. The first aspect that we come about is diet. In terms of preconceptional counseling, the diet is the most important aspect that the patient needs to keenly realize the importance on. Pregnancy involves a lot of changes in metabolism. It also involves a lot of changes in digestive capacity of the patient. And so, it is crucial that a healthy diet is taken care of much before the patient is actively pregnant. Certain patients have a very high BMI. That BMI has to be brought down. The body mass index has to be an optimum one for the patient to conceive, go through, and deliver well without any complications. In terms of body weight, if the patient is overweight, the preconceptional counseling, which is usually started 3 months prior to the active time of conception, helps us to manage the weight to an optimum level. If the patient has certain hormonal issues which are causing the weight gain, like PCOD, we also have a chance to complete and rectify that particular problem. At the same time, it also addresses to certain dietary changes, which are crucial in maintaining a healthy lifestyle while pregnant. We live, as we said, in an era where we are very easy to go on junk food or whatever is available. But for a mother, a healthy diet is of crucial importance for giving the right amount of nutrients to the unborn child and thereby also taking care of one's own health in the process. Changing of a diet is not a one-day process. It is a long process and it involves a lot of involvement in terms of individual involvement and family involvement as far as the changes for a long-term go. Therefore, one must definitely try and avoid junk foods. One must try and maintain a very healthy exercise schedule. One must definitely take a few supplements which are definitely needed to make sure that the pregnancy goes ahead uneventful. Folic acid is one such simple vitamin. It's a very simple vitamin, but it is proven beyond doubt that if you take it 3 months prior to the active time of conception, chances of neural tube defects, which is vertebral column abnormalities, or brain-related abnormalities, are decreased to a very, very great extent. It's a very simple tablet to take just once a day, and it affords a massive benefit. So definitely it is not something that everyone knows about, but if they come before conception, this particular part can definitely be taken care of. One should also screen oneself with a number of blood tests. Blood tests are of crucial key. Thyroid, as we know, is a very, very simple, basic hormone which is required for every single functioning of the body. Thyroid requirement for the mother or the one who is about to conceive is very different from the one who is non-pregnant. The TSH, as we know about, is a simple parameter which is used to check on the thyroid status. A fasting TSH value for a person who is non-pregnant, who doesn't want to conceive, the upper limit is 5.5. But the one who wants to conceive or who is actively pregnant should be brought down to 2.5. So if you fall in the gray zone of the thyroid, maybe around 2.5 to 5.5, high time we correct you on certain things to make sure that the thyroid is of optimal status so as to maintain all the parameters during pregnancy to an utmost best. There are also certain things in diet which need to be taken care of, like antioxidants in the diet. They help a lot in improving the quality of both the ovum and the sperm. There are certain lifestyle changes that a person should definitely think about. For example, avoiding a lot of caffeine, avoiding definitely smoking, drinking, alcohol for both the husband and the wife. Passive smoking itself also has a lot of detrimental effects on the ongoing pregnancy and even the quality of the embryo while the patient is smoking. There are a lot of implantation defects which are associated with nicotine per se, if it is an active abuse by the patient or the patient is passively smoking because of the spouse. So this needs to stop. The change, obviously, we know is not a one-day change. Any addiction is difficult to let go. It is a long process, but an initiative should be taken so that we are able to achieve what we want, the best embryo in the best milieu to thrive in the best way possible, in such a way that the maternal health is never endangered in the process of pregnancy. Screening, as I said, involves a lot of blood tests. The blood tests on a routine basis definitely from our side involve thyroid and prolactin checks. Prolactin is a simple hormone which is secreted by the brain. It is a pulsatile release hormone from the pituitary. Certain labs have a criteria of getting it checked tri-pooled, which is to check the blood every 20 minutes. Sometimes the patient is very hesitant. What is the sort of blood test which is taking so long? Or maybe it is getting tri-pooled. What are they checking, which is taking 3 samples for them? Well, it's a pulsatile sample, as we know. So it has its peaks and its troughs. So if you're taking a single sample, it may be a peak of the trough. But taking 20-minute 3 samples gives us an exact mean of the prolactin. And prolactin is a crucial hormone, which helps us judge whether or not a natural endometrium may form or not. If the prolactin is on the excess side, it hampers implantation. So again, such simple parameters are definitely important to be checked. Other than that, of course, many battery of tests can be performed. Screening anemia is one of them. In India, fair skin is definitely a very, very welcome sign. But for us as gynecologists, fair on a yellowish tinge is a bothersome sign because it may actually say that you're less in terms of your hemoglobin. That needs to be checked. If you're low in terms of hemoglobin, you should be put on good iron supplements, good diet which takes care of iron deficiency right before you're about to get pregnant. Because during pregnancy, the first 3 months, we avoid giving oral iron, even if the patient is anemic. We can only start iron after the 3rd month. So definitely, our care rests on your pre-pregnant iron levels also. Getting a good iron level also ensures a very good immunity level of the fetus. We as gynecologists and obstetricians always recommend taking an oral iron for a long time, even after you deliver, at least for a period of 6 months. It improves massively the quality of the breast milk. It takes care of your immunity and the baby's immunity. There is a rising trend of starting even vitamin D supplements. Much of us, thanks to the lockdown, are not exposed to too much sunlight these days. Sunlight is obviously the best source and the only source for vitamin D. So, if you're less in terms of vitamin D, you're less in terms of your immunity. As is with iron, you cannot start vitamin D high doses in early stages of pregnancy. It is not considered very safe, despite being a vitamin. There is a misnomer that all vitamins are safe, but then there are so many things which are not safe while you're pregnant. Overdosing on certain vitamins may also cause a lot of side effects. So vitamin D supplementation beforehand also affords a lot of benefit. It also, in its own way, acts as an antioxidant, which helps and works very well. Other blood reports obviously would involve screening of sugar and diabetes. It should be done for the couple, not just the mother. If the husband is diabetic, is having an active infection, he needs to be treated well too. The husband semen analysis is one such screening test. We encounter multiple patients who get pregnant but who undergo multiple missed abortions. It may not always be the mother's fault while the miscarriages are happening. It could also be the semen, which is probably not okay. Sometimes the count is very good, but the motility is poor. A low motility would always lead to a conception which is probably genetically not compatible, and thereby miscarriages happen. Sometimes miscarriages also happen because of a genetic abnormality, which can be either of the spouses. Normally, in a normal couple, karyotyping is not generally recommended, until and unless we do have a past history of recurrent abortions, maybe 3 times or more. In such a scenario, not just the karyotyping, but the torch infections need to be checked. At the same time, the antiphospholipid antibody syndrome antibodies for both the antiphospholipid and the anticardiolipid antibodies need to be checked, and the patient needs to be managed for the same beforehand too. The semen analysis, as we said, is a very, very simple parameter to judge the quality of the semen. If it is poor, nothing to worry. It can be taken care of simply by very, very simple antioxidants like CoQ10 in the supplements, and it can help improve the quality massively. If the count is very low or maybe borderline quite low, less than 10 million, we also advise a color Doppler scrotum. Sometimes it is a varicocele, which is just a swelling of the veins around the scrotum, which lead to a low count, which needs to be ruled out. Such simple maneuvers can help us put bay to a lot of future complications which may probably happen. From my side, as we said, there are also environmental factors in terms of preconceptional counseling which need to be considered. Many women work in industries where they're exposed to probable pesticides, where they're exposed to probable radiation. That needs to stop if you're actively trying to get pregnant, because even they have a detrimental effect on the embryo quality. I think it is time I sum up my lecture and we take a few of the questions that have just come around. So, our first question is from Sunaina. She's having PCOD and she hasn't had any issues since 10 years. She tried ICSI 5 cycles and no results. What to do now? See, recurrent IVF failures may have multiple aspects to it. The embryo quality, the endometrial receptivity, both are of crucial importance. May not necessarily be one factor that we can rule out as to why this has happened. But from our side, it is important to take care of whatever maternal aspects that you have in you that can be corrected. If you are high in terms of your BMI, you need to put that down. You need to exercise. You need to be on a good diet. Being on a diet never means eating only salads and soups. No. You need to have a proper nutrition in your diet. But you need to burn more calories. At the same time, as I said, a proper IVF specialist who can help you and guide you in terms of your ERA testing, which is endometrial receptivity assay testing. It's a costly report, but definitely it can help you a lot. It may help us figure out what exactly is going wrong. There are multiple ways by which we can actually increase the chances of conception in previous IVF failures. For that, we may sometimes talk in detail in another lecture. Does preconception, another question now by Manju, does preconception health apply to women who do not plan to get pregnant? Yes, of course. I would love to see that. Even if you're not planning to get pregnant right now, health is a circle which starts from infancy to childhood, to adolescence, to adulthood, to even midlife. Everything, every aspect of your life Health is crucial. Even if you're not planning to get pregnant, you may still come around and get yourself checked. If you are actively married, you should definitely get a gynec checkup done. A gynec checkup not only rules out a number of problems. You may have a hormonal problem like a cyst or a PCOD. You may have low ovarian reserve. You may have a fibroid. You may have some uterine abnormality, or maybe some congenital abnormalities of the uterus, which we may come across only by checkup, and which can be recommended and rectified right in time. Right now, I would like to mention such a case. I had a previous patient of mine who was just married, and she was not even very much keen on getting pregnant very quickly. But while examination, we came across a large vertical vaginal septum. We resected her, and 1 year down the lane, she got pregnant, delivered normally. With that active septum, she may not have practically made that to a normal delivery. But because she came beforehand, we were able to rectify what the problem was, and her entire pregnancy was completely uneventful. So such cases usually definitely ping on us, and they tell us that, yes, taking care of one's health is our own initiative. And we are the ones who are responsible for that. So whether or not you wish to get pregnant, the health is basically your own initiative. Getting a gynec checkup done should also always involve a pap smear in an actively sexually active female. A pap smear is definitely, as we all know from now, it's a cancer screening process. It's a very simple process done on an OPD base, but it gives us a lot of information about the cervix and its function. If at all a pap smear is abnormal, you can correct that also in time before you actively get pregnant. During pregnancy, there are a lot of hormones at work, so the pap during pregnancy may be awkwardly abnormal. So that is why everything should be done before getting pregnant, because during pregnancy, a lot of parameters keep changing every day. Another question by Rachna. When should we have a preconception appointment is what Akita asks. Ideally 3 months before, whenever you're planning to get pregnant, is the best time to get it done. A question by Rachna. How long before becoming pregnant should a woman start preparing for pregnancy? Same thing, 3 months. 3 months is considered the ideal time. If you've had any miscarriages before, then also we would recommend a 3-month waiting period for you to get pregnant again. The patient, the mother in question, needs to heal back from the previous abortive process to be able to be in a good condition to accept another child. Before pregnancy, definitely in such a case, further evaluations are needed, which would involve a lot of screening, as I said, for the torch, the APLA, the thyroid, the sugar. Everything needs to be checked, and then we may proceed forward. Sometimes, if you have a family history of certain illnesses, for example, if you have a heart disease and you've never got yourself screened before, you do find yourself little uncomfortable while walking stairs, a baseline ECG and 2D echo are also recommended. We've encountered multiple patients who have never had any issues, but who have been diagnosed with a lot of wall problems during pregnancy while they follow. Once you're actively pregnant, there's not much we can do about it. But if at all the patient comes at least 3 months prior to that, we may take care of even the cardiac condition and reduce the chances of maternal morbidity and mortality in a similar way. Okay, Lakshmi Mishra. The next question is from Lakshmi Mishra. Should do a preconception counseling before getting pregnant? Should everyone get a preconception counseling before getting pregnant? I would definitely recommend that. I would definitely want all evaluations to be done before you're pregnant. Once that is so, you're minimizing so many complications which may come across just because you were not diagnosed with a previously existing problem. See, sometimes it is so that a patient has hypertension. They may not know that they are hypertensive. But if we know that you're hypertensive, we could put you on a drug which is good in terms of your pregnancy. Not all antihypertensives are safe during pregnancy. So we'd want to take a switch over to a good and a proper drug. That is possible when we have time with us. Similar thing goes around for epilepsy. बहुत सारी स्त्रियों को खींच का प्रॉब्लम होता है, जिसमें खींच आ जाती है, फिट आ जाते हैं। एपिलेप्टिक फिट्स का जो प्रॉब्लम होता है, अगर हम उसके लिए भी कुछ अलग किस्म की दवाइयाँ ले रहे हैं जो प्रेग्नेंट पेशेंट के लिए सेफ नहीं है, तो हम उनको स्विच ओवर कर सकते हैं अच्छे और बेटर ड्रग से, जैसे कि लेवोटिरासिटम है, जो सबसे लेटेस्ट ड्रग है, वो सबसे सेफ है। पर ये काम हम तब कर सकते हैं जब हमारे पास थोड़ा समय हो. So that time we need to buy, and that time is definitely before you're getting pregnant. Another question by Meghna. I had 2 miscarriages, both at 6 weeks. After my second miscarriage in June 2020, doctor said I have PCOS. She's 29 years of age. The BMI is 26, which is good. What can be done to overcome PCOS? My period cycle is 29 to 34 days. When again can I plan pregnancy? Do I need? I think the message is around. Do I need? Okay, maybe the message is oncoming. So Meghna, if you've had 2 miscarriages at 6 weeks, you definitely need a lot of evaluation in terms of why those miscarriages in fact happened. The first thing I would like to go for is karyotyping, both for the couple. Sometimes a couple karyotyping helps a lot. If it is a miscarriage at such early weeks of pregnancy, it probably has to do with a genetic incompatibility by the embryo. Blighted ovum, usually blighted ovum or lack of growth within the baby, wherein the baby doesn't grow well on the scan at all, happens because of genetic incompatibility issues. It may be because of either you or your husband, so that needs to be taken care of. Regarding the PCO aspect, if you're having a natural, normal period cycle, even if it is a 34-day cycle, I would not want to label you as a PCOS. Until and unless it's a documented PCOS, both morphologically on the sonographic scan, if on the sonographic scan we are seeing number of multiple follicles distributed in the periphery, just like a necklace, a pearl necklace appearance in the scan, and at the same time your parameters in terms of your hormonal status are all deteriorated, which is to say your FSH-LH ratio is altered, your fasting insulin is high, then definitely you're probably PCOS. For PCOD, there are multiple therapies which are available. Despite you being in a good state of your BMI, you may still need lifestyle changes. This is proven beyond fact that a change in the diet, even in a lean PCOS, works very well. Exercise and diet go hand in hand with PCO treatment. So though both need to be followed, at the same time certain supplements need to be also taken care of. For example, if you are having a fasting insulin which is higher than 15, near a documented PCOS, then we may start you on an insulin sensitizer like metformin. Or certain drugs like chiroinositol and myochiroinositol also afford a lot of benefit in PCOS. As far as the conception goes, you should definitely try conceiving again, because the last miscarriage was 1 year back. We have another question by Sonal Arulekar. She had a stillbirth last year in July with C-section. Unfortunate. Still not conceived after trying since March. Okay. So Sonal, I do not actually know why that stillbirth actually happened. But if it was a stillbirth while you were actually in labor, you could be a case of GDM. Gestational diabetes mellitus, if it was not screened in your first pregnancy, has to be screened this time around. You should definitely get your fasting, BPBS, and your HbA1c levels checked. They may deceptively be very normal even here, right now, preconceptionally. But once you actively get pregnant, I would definitely want you to get a proper GCT done, which is a glucose challenge test done at 24 weeks of pregnancy to rule out diabetes during pregnancy as a cause of childbirth, still childbirth. Stillbirth could also be because of a complication while delivering. It could be because of a hypoxic injury to the child. I would want to go into the details, but I would want a lot of reports to have a look at what exactly went wrong at that time. If you're not able to conceive since March, don't worry. Don't panic. See, sometimes even if you're trying and the couple, both parameters from the couple sides are absolutely normal, a couple may still take 6 to 9 months to conceive. So even if it's taking time, do not press on yourself and feel that there's some parameter which is going wrong within you, which is causing this problem. No, it is very natural for us to take time because there are a lot of factors, despite the science being so advanced, there are a lot of natural factors at work which may not allow conception to happen in the given time frame which we are expecting. So just be patient with the process. From my side, the only advice I can give you is definitely take a good folic acid supplementation right now. Rule out anemia, rule out thyroid. Take care of your blood pressure. If at all you're not noted that down over a long time, definitely get your blood pressure checked and your sugar status checked. And whenever you wish to conceive, you should have intercourse on alternate day basis from the 10th to the 20th day of your given cycle, which is mostly the time when ovulation occurs. The other question is by Shruti Samantha. My cycles are not regular. I get my period after 2-3 months. PCOD, is there a less chance of me to get pregnant? If yes, what can I do to increase my chances? Yes, of course, PCOD does include a factor of subfertility in patients, not complete absolute infertility. But PCOD, because it is a disease where ovum is not getting formed, जो स्त्री बीज होता है वो नहीं बन पा रहा है. बच्चे को जन्म देने के लिए स्त्री बीज का बनना डेफिनेट आवश्यकता है. अगर वो नहीं बन रहा है तो ऑब्वियस है कि उसके साथ अगर पुरुष बीज नहीं मिल पाएगा तो बच्चे का जन्म क्वेश्चन में नहीं आ पाएगा. उसको कंप्लीट करने के लिए सबसे पहले हमें ये करना पड़ेगा कि हमें पीसीओडी के फंक्शनिंग को समझना पड़ेगा. PCOD is a diverse disorder. It is a hormonal disorder which is causing your period irregularities, but it is also a metabolic disorder which may lead to weight gain, which may lead to lack of or insulin sensitivity, also known as insulin resistance. All of these factors, they start contributing a lot in terms of your metabolism per se and in terms of the milieu inside the ovarian stroma, which contributes to the follicle not forming at all. Today's science is very well advanced. If you're taking care of PCO with a diet, exercise, lifestyle changes, a lot of supplements, and you've given yourself 3 months, PCO is completely reversible. You may not even require another drug to conceive. But sometimes PCO may recur very quickly after the given time frame. So it's not necessary that a patient with PCO may recover with 3-month therapy. That similar patient may require sometimes 6 to 9 months of therapy. We also have drugs which can help you conceive well with PCO, but definitely it should be done under a good obstetrician and gynecologist care who knows the pros and cons of your case per se. From my side, the only advice I can give you is definitely get yourself evaluated well for the PCO. Get all the hormonal reports done with. Sometimes a prolactin excess can mimic a PCO on sonography. So we definitely need to be sure whether or not it's a confirmed case of PCOD and then label it as PCO. Sometimes a thyroid abnormality can also lead to period cycle abnormalities, delayed cycles. So it may not necessarily be so that you're a PCO. It could be a thyroid issue. So get your hormones checked and definitely evaluate your chances. And if you wish to get pregnant, take care of your hormonal status as early as possible, so that you may not even require therapy for conception. Another question by Shweta Malhotra. Does depression have any form of problem in pregnancy? Obviously, yes. Yes. We so not regard the mental health of the mother. The preconception counselling also involves a lot of weightage on the mental health. It is basically a way of planned pregnancy, also a way of avoiding the unintended or unplanned pregnancies. An unplanned pregnancy can wreak havoc on the mental health of the couple per se. If you're not mentally prepared for a child and you do conceive at that time, it may not be doing very good for you in terms of your mental and social health factors are concerned. Depression per se can happen to everyone and anyone in this given world, filled with stresses of all sorts. But if you're on a tablet for depression, then we need to evaluate whether or not it is safe for pregnancy. If you're not on any medication for depression, then I would highly recommend for you to exercise. Exercise is considered the best antidepressant. Doing a cardio workout for at least 30 minutes a day helps release the endorphins in the brain, and that can help revert back depression. What I personally recommend most of my patients is just that take half an hour time out for yourself. Do what makes you healthy and happy. Anything that makes you happy. Read a book, music, movies, binge watch on Netflix, for all we know. But do that half an hour activity which makes you happy. Maybe just lie down and perform some yoga, meditation. That helps. It helps a lot. Okay, so I think it's a wraparound as far as the questions are concerned. For the depression part, I hope, Shweta, I've answered your question well. From my side, I would definitely recommend if you're in a very, very serious case of depression, you seek and sought help. We can assist you in a certain way, but you have to assess your problem on your own way. If you feel it is of a massive level, we need to definitely take care of that. Consult a psychiatrist and go on a medication, which could be safe for pregnant patient as well. So from my side, I hope I have made my point pretty clear to everyone that it is not just the pregnant mother or the unborn child that we need to take care of, but it is the woman in question, who is a mother to already some child, who is a wife, who is a daughter, daughter-in-law, who's just performing so many roles single-handedly. We need to take care of the health of that woman completely well. We're supposed to be very sure about her health before we pose her to something as big as a pregnancy term. Because during pregnancy, as I said, there are so many changes that happen so rapidly that if you're not already well prepared in terms of your body, mind, and spirit, things may not turn out the way we want them to be. So to assure that we have least maternal complications during pregnancy or after delivery, to assure the fact that we have least amount of fetal abnormalities, fetal congenital defects, low birth weights, stillbirth weights, we need to focus on the part before conception. We need to be evaluating those factors pretty well. It is all in our hands, completely in our hands. It's only our choice that matters. We need to choose what we want. And everyone here would agree that we would want a healthy baby, a healthy mother, and a completely happy family. And I hope that most of you are now enlightened on the fact that preconceptional counseling can help us reach that goal. Thank you.